Hello, I'm Dr. Vaishali Bhalerao. I'm an obstetrician gynecologist and a general practitioner here in Australia. Today, we are going to talk about vaginal dryness, and Varsha has some question. Varsha, my sister from India, she's come here and she's going to ask some questions about that. So, what do you want to know about vaginal dryness, Varsha?
So what are the different reasons or causes for because of that the dryness occurs?
So, vaginal dryness usually happens because of the lack of estrogen. So, estrogen is the hormone which is produced in first half part of the menstrual cycle. So, when there is a lack of that hormone, then there is a decreased secretion from the vagina and thinning of the skin of the vagina, and that causes dryness. So, whenever there is a lack of estrogen, now as you know, whenever means when I say whenever of the lack of estrogen, after pregnancy, delivery, after delivery, when the woman is breastfeeding, then she doesn't ovulate. Her ovulatory function doesn't come back, especially when she's exclusively breastfeeding for first 3 to 6 months. That time her ovaries are not functioning, so the egg doesn't get developed, and because egg is not developing, there is a lack of estrogen. That is the first time the vaginal dryness can happen. And the second time when vaginal dryness happens is near menopause, like perimenopause and postmenopause. So during that time, the vaginal dryness can happen.
So what is the solution for that?
Yeah. So not all women will be sensitive to vaginal dryness. So what happens in vaginal dryness is that when a woman has some intimate relationship, then because of lack of lubrication, then there can be some irritation or pain while having that intimacy with your partner. So when that happens, then obviously that develops a bad memory and then causes future bad intimacy or bad intercourse. So what was the question again you said?
So what is the solution for that? Can we use oil or coconut oil or anything?
Yeah. So the solution, solution is especially when a woman is just delivered, and it's not going to last for long. The breastfeeding, exclusive breastfeeding and ovulation, that means not having the eggs developed, that is not going to last long. It can be 3 to 6 months maximum. During that time, using a lot of lubrication helps. Okay, so lubrication can be in form of anything, like those are available over the counter. It can be a moisturizer, it can be a oil if your body is okay with that. But see to it that whatever you're using is quite clean. In postmenopausal age, this dryness keeps on getting worse because there is absolute lack of estrogen. So if the dryness is too much and that is really affecting your intimacy, then using a topical, like a topical estrogen cream or a pessaries, that means estrogen comes in form of a gel or a cream or a tablet which can be inserted into vagina, can be used. But of course you need to find out whether you can use that, because there are some contraindication and there are some condition in which you're not supposed to use that estrogen gel. That can be used, but to begin with you can always start with using the lubricant. Okay, that most of the time that helps. Not all women require the topical estrogen cream.
Okay, so you said that there are two main stages after the delivery, or pre-menopausal or after menopause. Is there any disease because of that the dryness can start?
So if there is an injury, if there is a scar formation, like a women who have undergone some vaginal surgeries, prolapse repair or even removal of the uterus. But even if the ovaries are there and there is too much dryness, that scar usually can't secrete as good as the normal vaginal mucosa can secrete the secretions. So that time there can be dryness. Also, those women who had bad memory while having intimacy, like during intercourse, then they don't get excited, and that can cause dryness as well. So we can't always blame the estrogen. Okay, so that's why you need to, if you're having that, then it's always best to go to your general practitioner, or you can go and see the gynecologist and get it checked out what exactly is the reason, whether it is a mind or whether it is a psych or it's a bad memory which is affecting your vaginal dryness. And the skin usually vulval skin problems, some itching or some conditions like lichen sclerosis or even chronic vulval itch, like what we call as chronic lichen simplex, that can be causing the thinning of the vulval skin because of continuous itching, and that usually doesn't cause vaginal dryness, but it can cause irritation over the vulva and even in the urinary area when they are passing urine. So at any point, the problem is that we can't look at our vulva exactly, so if anybody is having those things, it's best to, of course, we need to go ahead and take proper care of our vulva, like washing ourselves, keeping the skin really moisturized, and keeping the normal length of the hair, like as I always say in my videos, 2 to 3 millimeter of skin, trimming the hair, and then apply Vaseline jelly at night, moisturize in morning. And if that is not helping, it's best to get checked out, and if that is something which is not dealt by a general practitioner, it's not a bad idea to go and see the gynecologist. Okay, so you should try doing that. And if you have any more questions, I'm talking to my audience now, please write them on the comment, and we will get back and then answer those questions. Okay.